I love this, our feature every week where we go into, we're all sports guys, right? So we all love it. And we're all weekend warriors and driveway heroes. And, we run into all kinds of issues. So it's great to have the Rothman team at our disposal. Rothman Orthopaedics, who specialize in you. And joining us right now, she's amazing. Dr. Meghan Bishop. She's a surgeon for Rothman, obviously. And, of course, she's the head team physician of Drexel University. She specializes in knee, shoulder, and elbow. Doc, good morning.
Good morning, Anthony. Good morning, everybody. Thanks for having me.
What a pleasure. Are you kidding me? So I want to get into the hyperextended knee, Doc. All right? So we've all kind of done that playing ball where that weird feeling, all of a sudden you do it and your knee feels like it's floating.
Yeah, so there's a number of different motions your knee can undergo when you feel like it's floating, but particularly with a hyperextended knee, that's when your knee overbends backwards. Or another way to think about it is when you actually overstraighten your knee or hyperstraighten your knee. So it can cause a different type of injuries than certain other motions, like a pivot or a twist or like a hyperflexion type injury. They can cause different type of injuries than the hyperextension injury where you actually overstraighten your knee.
Well, that's interesting, guy. You didn't think about the relation, and I guess, Doc, that's one of the things that when you're looking at these injuries, how it affects other parts of the body is such a big deal, especially when we're talking about professional athletes.
Yeah, absolutely. And how the injury occurred is important too. Specific with Paul George's, I believe, was a non-contact type plant,
right,
where he hyperextended. So you can also hyperextend your knee when someone runs into the front of your knee. So that can be a little bit more high energy trauma and cause even more damage potentially.
When they say it's a bone bruise, what does that mean?
So a bone bruise is probably one of the best case scenarios you could get from a hyperextended knee. It essentially is a tiny little micro fractures that you get in the bone that hurt and can cause some fluid and swelling in the knee. But it generally will heal on its own with rest and time. Does not require surgery or any kind of further intervention to be able to get that bone bruise to heal. So it's essentially when the two bones, when you hyperextend, kind of bang into each other, and it causes a bruise just like it would anywhere else on your body.
Yeah, it's fascinating. I was just thinking the same thing. That's where the two bones come together with force, right? So because of that trauma, that force, it causes the trauma.
Exactly. And, you can injure other things with a hyperextension injury. You could injure cartilage. You could injure ligaments inside the knee. So it's pretty much a best case scenario when you just come out with a bone bruise.
All right. So when we're looking at, in this case, Paul George, because the opener is next week. And let's just also let everybody know that, Doc isn't treating Paul George. So we're talking about more in general, that injury. What's the best case? Is it just complete rest? Do you have to do anything? And is there any concerns that you could come back too soon?
Yeah, I think the recovery from a bone bruise depends. It depends on how significant it is. It depends on their activity level. Obviously, Paul George is a high impact, a big guy, going to be putting a lot of pressure on that knee. So things you want to look for are no pain anymore with weight bearing. You want to make sure that he doesn't have any swelling in the knee. That should be resolved. And occasionally you could drain the knee and remove some swelling, and that can help speed up the process as well. But those are kind of the factors that you're looking for to make sure that his swelling is gone, his pain is gone, and he's able to do some sports-specific rehab to be able to make sure he's ready to get back on the court. This could be from a few days up to maybe a couple weeks.
All right. I mean, listen, it's a long season, and one of the things, especially when you're dealing with delicate guys in their 30s that have played a lot, like, is there such a thing in basketball where it's just the amount of pounding for all those years, right? That there is this cumulative effect that wears down knees?
Absolutely. And that's really with any type of athlete or person that does high impact type sports. You can get micro trauma to the knee. You can have injuries that at some point will accumulate, and you can actually get some arthritis in the knee that may cause some flare ups. So hopefully he's not experiencing that, but it's certainly a possibility as well.
And that's where load management was born, right? Like it's, hey, we have to try to minimize just their exposure to it.
Yeah, and I know they're doing that with Joel, it seems like this year a lot with an amount of injuries he's had to his knee as well. So it is a long season, like you said. So the goal is to be able to get them ready for and they're healthy in the playoffs.
Dr. Bishop, what's your favorite sport?
Well, I am a former long distance runner, so I would say,
Wow.
but I love track and field and marathon running. But I guess in terms of the main sports, I would probably say football. I'm a big Eagles fan.
Ah, nice. That's awesome. Hey, real quick, Dr. Bishop, the long distance, we have a lot of runners in the audience. What's your best overall advice for, you look at people in their 40s and 50s and 60s that are still enjoy running to kind of, help, really protect themselves so they can run?
Yeah, and that's a great question. I always recommend, especially if patients are having some problems with injuries at that time, to incorporate some cross training too. Potentially not just make running your only form of cardio exercise. You can get on the elliptical or try to swim in a pool, ride a bike a couple days a week, but you can keep doing running, but maybe not do it every day if you find, especially with knee pain specifically. I also think it's actually really important to incorporate sports massage in your 40s and 50s too. You're just not quite as limber as you used to be, and I think it's a good way to be able to help the muscles recover.
Well, that's great. Yeah,
I always love
the
good
limber.
massage.
Yeah, the limber.
Good excuse to get one, yeah.
Yeah, I'm just feeling it now. I know I'm way too tight. I got to do yoga. I got to do the hot yoga. Dr. Bishop, what a pleasure, man. Really, it's great to talk to you, and it's great to have Rothman Orthopaedics on our team, man, at our disposal.
Yeah.
Thank you.
Yeah, thanks for having me. Have a great rest of your guys' day.
Go Birds.
Go Birds.